We're in the studio with Dr. David Klein, and we're talking about chronic cough. Now, there are those of you that just think every year you get some sort of cough, comes with the season. You get the pollen out there, you get a cough, and you think, well, maybe this one's lasted a little bit longer. Don't think anything about it. Try some over-the-counter drugs. You could be hurting yourself. So basically what happened to me was I'd been coughing for several weeks. I go in and sit down with the doctor at one point on an appointment that was for something totally else. He's down the hall, and he hears somebody about to cough their head off, almost to the point of having to rush to the bathroom. And he came down and said, "You got chronic cough. You got whooping cough. We better take it from there."
All right. The issue with cough, okay, is that there are many, many different types, many different causes of chronic cough. Acute cough, call it what you want. The doctors go through something called differential diagnosis. What are the possibilities from the most likely to the least likely? But floating to the top are those causes that may be life-threatening or limb-threatening. With cough, we do very much the same thing. So here in Florida, okay, it's a little bit different than it is in many parts of the country. We have an unusual combination of beautiful weather, lots and lots of rain, humidity, and oddly enough, this odd flora. Florida was derived the name from the Latin for plants. Okay, guess what? We have lots and lots of plants, and with these lots and lots of plants, we have lots and lots of pollen. Okay, so it's not uncommon for multiple times during the year for individuals to develop allergies. Now, they're going to be different from the allergies that one may have had living in another part of the country. Makes sense. As soon as you move here, you're feeling better. That lasts about 2 years, sometimes 3. Then all of a sudden, you're coughing and sneezing with the rest of us. Nah, you may not be seeing too many dandelions. Nah, you may not be seeing dogwood. Nah, you might not even be seeing apple trees. But you're sure as heck going to be allergic to things like bottle brush and certain types of oaks. Not the same oak that were present up north. Very, very different. These are the variety that are they'll paint your car yellow. You have a black car, it becomes a yellow car. You have a red car, it becomes an orange car. And if it's blue, it becomes green. That's the way that it's going to become. But what's going down and onto your car is also going into your lungs. So it's not uncommon for people to awaken with allergies, to awaken with the pollen sorts of issues. Easily enough treated. What do you do for this? You have an abundance of over-the-counter preparations, most of which are doing you harm. Why? Because you're over the age of 50. Most of you are anyway. Some of you are over the age of 60, and a number of you are over the age of 70. As you get older, you become more and more sensitive to something called the anticholinergic and antihistaminic effects of these cold preps. Now, why and should you care? Because symptoms of Alzheimer's result from histamine and acetylcholine insufficiency. So how do we treat Alzheimer's? By giving prohistaminic and procholinergic medications. So inadvertently, you are increasing your risk of developing things like Alzheimer's or developing Alzheimer's-like symptoms. So you have to be very, very careful how you deal with these allergies. The way I prefer to do it is to use a combination of things that involve neither chemical pathway. What does it take? Quercetin, Quercetin dosage. There's 500 milligrams twice daily. This is a marvelous herb. The stuff will settle down the immune system very, very nicely, and it gives you other benefits like reducing your risk of cancer. Imagine that, taking care of your cold, your allergy, and minimizing your risk at the same time. MSM, methylsulfonylmethane, 1,000 milligrams twice daily. Marvelous approach to the treatment of allergies. Last but not least, bromelain, Bromelaine. Bromelain is interesting in that it settles down the cytokines. These are chemicals that are involved in the allergic process, and wouldn't you know it, you're doing all of this without antihistamines and without anticholinergics. But what else? So you go to the doctor's office and you have this cough. Well, it's awful as a physician to understand and realize that many of the things that we do actually make people worse, or they make them sick. You know, the in Latin, primum non nocere, okay, first do no harm, okay, is sometimes not as easily done as it is said. Medications that we use to treat blood pressure in particular can cause chronic cough. Lisinopril is the most popular of the bunch. The stuff is cheap. They give it away at many of the pharmacies for blood pressure, but along with it is a 1% chance of developing a chronic dry cough. If this is the case, simply you stop it and take something else. You do need to treat the blood pressure, otherwise you may have something more serious like a heart attack or stroke, but the cough that goes with it is preventable, but it's treatable simply by changing medications. what are the sorts of things that we worry about with individuals with chronic cough? Most notably would be infectious disease. So individuals with chronic cough, productive cough, you might be asked by your physician, do you have any night sweats? Do you find yourself getting sick in the middle of the night? Are you having any fevers or chills? Now, why would this be important? Because it's not uncommon, actually, in the state of Florida to come down with tuberculosis. TB is treatable. TB is one of those sorts of things that you need to know about because it can cost you your life. So being checked for tuberculosis is as easy as going to the health department and asking to be tested. All you have to do is walk in there and say you've been exposed. They'll give you the time test. You paid for it in your taxes. Go get it done. A TB time test is painless. You do it and you're done with it. But what other sorts of infections can cause chronic cough? Whooping cough is one of my favorites. If you had to pick a favorite disease, whooping cough would be one of mine. What's this all about? Well, it's the same bacteria that your dog gets in the kennel called kennel cough. Isn't that interesting? Okay, very, very popular amongst pooches. You know, veterinarians are known to get this stuff, but so can you. So what does this mean? It means 1/3 of all persons, 1/3 of all adults floating around with chronic bronchitis may be harboring Bordetella pertussis or Bordetella parapertussis as the etiology, or as the agent that's causing this. How do you test for this? It's simple, actually. What you do is you go through nasal secretions. It takes 45 minutes with our DNA machine, and we'll tell you whether you have pertussis or not. Simple matter. Okay, it's an easy test. It's painless. It does take 45 minutes. So what else do we do about chronic cough? Well, one of my favorite problems here, and this is what I suffered, is reflux esophagitis. How does this work? It's called heartburn. You put on a little bit too much weight, too much blubber on the stomach, and it puts pressure, which pushes the stomach contents from the stomach into the esophagus. Some of it works its way up to the vocal cords and throat, and wouldn't you know it, you wake up with a cough. That cough can last all day long. It can be a misery. So how do you deal with this? Well, by taking antacids, that might be necessary. I take Pepsid twice, 3 times, 4 times a week. I won't take it every day because you have to have that stomach acid in order to digest your food, to absorb B12, magnesium, and a bunch of other things. So that acid is not put there by mistake. But the most important thing you can do is lose weight. If you're able to lose weight, you'll fix this problem. The second thing you want to do is to get yourself a wedge pillow. Where I bought mine was Bed Bath & Beyond. Why? Because I'm cheap. It was $30. If you want to go to a medical supply house, it'll cost you 3, maybe 4 times the amount for the same pillow. $30, Bed Bath & Beyond. If you go on Amazon Prime, they'll ship it for free. It does work. Elevate your head. Take Tums before you go to bed at night. Don't eat after 8 p.m., and that cough will go away. Very, very interesting. So infectious disease, we've talked about allergies, we've talked about reflux esophagitis. What other sorts of things can cause chronic cough? Well, I haven't been mentioning lung cancer. I haven't been mentioning the effects of cigarette smoking. These are things that you already know. Okay, but they must be looked at in the light of, chronic productive cough comes from something. So a chest x-ray will sometimes give you the answer. Sometimes you have to take it a little bit further than that. Irritation of the lungs can happen. So these sorts of issues follow autoimmune diseases and so on and so forth.
All right, you kind of scared me when you said tuberculosis. We used to see movies about that, and people were put in sanitariums.
Oh, you betcha. Okay, and
what changed?
Well, they don't have sanitary anymore. Okay, they kind of went out of business when they started learning how to treat it with antibiotics. So there are ways to use antibiotics to treat tuberculosis. You are infectious right up until the point where you start taking the antibiotics and the bacteria start to be killed. So it is a concern. Okay, we used to have to test the children before they went to school.
Yeah.
Okay, they don't do this anymore.
Oh, boy.
Yeah, and so we're asking for trouble. My advice to you is to go to the health department. Okay, claim that you've been exposed. They will do the time test for free. Okay, get it done, get tested. And just because you test negative now doesn't mean that you won't convert later. It does happen that way. People get exposed all the time. But this is terribly important, and it's a treatable cause of decreased lung function, something that we should all be concerned about.
You need more information on the doctor and the practice stages of life, go to suffernomore.com, suffernomore.com, and stagesoflifevitamins.com, stagesoflifevitamins.com, and we'll see the doctor again tomorrow.